This video is about CPOE with stroke patients, specifically managing tPA, and then one little item about how to document in a specific way in order to document for quality measure purposes. So let's just start here by searching the order sets for ED stroke. You see two sets here. There's the main stroke order set, which we'll look at in a minute, and then this is just the tPA med order itself. So this is obviously a high-risk situation that we want to be careful with, and a lot of work has gone into the development of this. It looks pretty simple now, which is good. There are basically two ways to order it. There's one where you want to hold the tPA. You want pharmacy to draw it up. You want it to be held at the bedside, and then you want to give it. The other is, if you know for sure you're giving the tPA, you want to be able to order it with one click and then file it. So let's say we're given the tPA. There it is. You would go ahead and file that order. There it is. Let's say instead that you're not sure if you're going to give it. You would go in here. You want the pharmacy to go ahead and pull it up. You go ahead and you file that order. So again, that process is pretty similar there. The major difference is that that first order has gone to the pharmacy, and it's going to come up, and the nurse on the electronic screen is going to go ahead and give that drug. This next one is the nurse it's going to say hold for authorization. So when you do know that you're going to give it, then that's when you use the other order, the authorization to give. So you need to do two things here. One is verbally make sure the nurse knows it's okay to give the drug, which I'm sure will happen as a matter of usual course anyway. But then the other part is the nurse needs to have the official order to support her administration of the drug, and that's what this does. I do want to go in and show you something else in the ED stroke set itself. Two things. One is that there are all the nursing orders and laboratories and fluids and CT imaging things are down here at the bottom. So this is that other set, basically as a subset that's collapsed down at the bottom. Recognizing that you won't always know right up front whether or not you're going to do that, but if you do want to, that other set is appended to the bottom of the main stroke order set. I will point out too that there is the head CT for patients who are not tPA candidates, and then there's ones with the for the stroke protocol that are be expedited through the radiology department. The last thing I want to point out is this order here at the top, this quality metrics section. So if you're not administering tPA and the patient is a candidate for it, then we ask that you go in here to this order. This is basically documentation that's phrased as an order. So if the patient's a tPA candidate, then we ask that you document why you're not administering tPA with one of these canned text items. So you could argue with the selection of these words. This was not my decision. This is the federal government's selections, and this is an electronic clinical quality measure that's kind of carved in stone. So basically, if they'd recently had surgery, you'd pick surgical contraindication. They had severe hypertension, medical. If they're on Coumadin, comfort measures, whatever, you can find one of these categories that should suffice. So that's a way to document for clinical quality purposes. Thank you.